What is suicide? Suicide is when someone harms themselves with the intent of ending their life. All people can be at risk of suicide, no matter their age, gender, ethnicity, and although there is not one main cause of suicide, the main risk factors are depression, losing a loved one, bullying, abuse, discrimination, or financial troubles. Terms such as committing suicide, successful suicide, and failed suicide carry negative meanings and should be avoided. What is suicide prevention? Safety planning enables a patient to work with a guardian to find ways to limit their access to dangerous substances or weapons, create a safer living environment, and also helps a patient identify coping methods. Follow-up phone calls and further screening have also been proven to reduce a patient's risk of suicide. Various psychotherapies and prescribed medications are used to help patients who may have attempted suicide in the past or may in the future. Since friends and family are usually the first ones to recognize warning signs of suicide, they can help a loved one find treatment for mental health. Some warning signs that you can identify that show suicidal behavior are talking about wanting to die, withdrawing from family and friends, giving away important possessions, taking great risks leading to death, using alcohol and drugs often, etc. These are not ordinary responses to stress, and if someone you know is exhibiting these signs, you should get help immediately. There are steps you can take to help a loved one who is in emotional pain. Number 1. Ask a struggling loved one if they are thinking of killing themselves. Studies show that asking if they are suicidal does not increase suicidal thoughts. Number 2. Keep them away from harm by removing access they have to lethal items or places. Number 3. Listen and empathize with what they are feeling and thinking. Studies show that talking about suicide can actually decrease suicidal thoughts rather than increase them. Number 4. Encourage them to use resources that can help, like the Suicide and Crisis Lifeline number. Call or text 988 and the crisis text number 741-741, or call a crisis counselor. Number 5. Stay in touch with loved ones, check in on them, and let them know that you are there for them.